Ruth Goodwin-Groen. I'm the Managing Director of the Better Than Cash Alliance, and I'm delighted that you are with us today. It's morning in New York, and it's very early on the west coast of America, so welcome to you. Afternoon in Europe and Africa. So glad you're able to join us. And evening in Asia and the Pacific. And for those of you who are having this over a nightcap or listening to us over a nightcap, we hope that we'll keep you awake with a very stimulating hour. So glad that you were able to join us. I'd also like to welcome, of course, Brian Loeb, the author of this toolkit. Brian has managed the Development Results Focused Research Program between Bankable Frontier Associates and the Better Than Cash Alliance over the past 2 years. And he has drawn on the experience of the 4 diagnostics that we've undertaken for this toolkit. So it's really great that you're able to have produced such a great toolkit, Brian. And welcome to you today.
Thanks, Ruth. Thanks for having me. And I want to take a second to thank all my great team members on those 4 country diagnostics that you mentioned, not just my BFA colleagues, but our partners at CGAP and the World Bank. They did a lot of hard work to build up this methodology, and I couldn't be here, and this toolkit couldn't be here without them.
Yes, that's one of the great things about being part of an alliance, Brian, is that we have terrific members and partners, as well as the broader alliance members who are all committed to moving away from cash to electronic payments. So I'd like to just give a quick introduction to the Better Than Cash Alliance for those who don't know us. We are a UN-housed global alliance of governments, private sector, and the development community who are all committed to moving away from cash to some form of electronic or digital payment or transfer. We do 3 things. We advocate for that shift away from cash to digital, whether it's government benefits, humanitarian aid, payroll, salary, supplier, anything that's currently cash in payments or transfer to move to electronic or digital. We develop cutting-edge research, good practices, case studies, and of course toolkits. And we provide technical support as appropriate. And on these toolkits, they were started in response to demand from our members, that people were asking us, so where do we start? We get the idea, we think it's terrific, but where do we start? How do we approach this dilemma of moving away from cash, because we've done that for so long. So we developed 5 toolkits, one each for our stakeholder members, governments, private sector, and the development community. And then there were 2 additional toolkits for a diagnostic of the whole ecosystem, and that's what we're addressing today. And then tomorrow we'll be looking at the measurement toolkit. So we're very glad to be able to pulling it all together today. So let's look at the agenda. We're going to have an overview of the toolkit, and you should know that this won't be a PowerPoint like you see here with bullet points. There'll be screenshots from the toolkit, so there'll be more text than you're used to for a webinar like this, but it'll give you a sense of what's actually coming, what you'll be actually seeing. We're going to be looking at asking who would conduct this diagnostic and why, and what distinguishes a Better Than Cash Alliance style diagnostic from many of the other great approaches that are out there. And of course, we'll be looking at how to get started with your diagnostic. As Maura said at the beginning, if you look at the right side of your webinar control panel, there is a section for questions. So as we go, please put that in. They will come straight to us here. They're not public questions, but we will then have time to address those at the end of the webinar. So there's a question and answer session, and then we will be looking at next steps from this, which will be joining a community of practice. You'll be able to download the toolkit and join a community of practice that is addressing this diagnostic toolkit. And also we want your feedback. So we'll be looking at how to get that over the next month. So that's where we're going to go today. So I should just say that we will be recording this so that if you get called away, you can come back later. So Brian, let's get started. Where did this methodology come from?
Thanks, Ruth. We have a solid evidence base for this toolkit. As you mentioned a couple minutes ago, we did indeed conduct 4 of these diagnostic exercises in 2013, one in Colombia, one in the Philippines, one in Nigeria, and one in Malawi, and like I said, with our partners at CGAP and the World Bank. And a little bit of news here on the call today. The Colombia diagnostic is now public, and Ruth, I know you're going to talk a little bit more about that, so that's great news. So if you want to see all of this methodology in practice and what it looks like in report form, you can head to the Better Than Cash website to download the Colombia report. But we aren't only building on our experience from these 4 diagnostics, we're also building on some great other payment analysis methodologies developed by our partners. And during this webinar, I'll talk a little bit about what those other approaches do and what we think we're adding on to with this approach. So we think of a BTCA style diagnostic as a forward-looking view of a payment system and a specific part of the payment system. That's a little different than the webinar in the toolkit you'll hear about tomorrow from my colleague Wajiha Ahmed on payments measurement. That's looking at what's happening today and very focused on the current state of payments. In a diagnostic, we're trying to identify the trajectory of a part of the payment system given the present conditions. Do the conditions enable a shift to digital? And we call it an ecosystem diagnostic because within your chosen focus areas in the payment system, it's looking at the incentives of all the relevant stakeholders, not just from the perspective of one key actor or another.
Brian, that ecosystem point is a very important one, and we realized just how important it is over the past 18 months. And I just wanted to remind everybody, when we started this almost 2 years ago now, it was in response to demand from our members, but we weren't sure whether we could get the data, whether it was going to be valuable, and whether the countries would be prepared for the data to be public. And so over the past 18 months, we realized we could get enough data for it to be interesting. Not everything, of course, it's not completely perfect, that it was hugely valuable. The response has been overwhelming in those countries, and that the countries have been prepared for it to be public. We weren't sure, but in Colombia it's now public, and it's in process in Philippines and Nigeria. So we have been thrilled by that. And in fact, in Colombia, just 3 weeks ago, we worked with the Colombian Ministry of Finance and our other partners there and launched the Colombian diagnostic at an ecosystem convening. So all the relevant stakeholders were part of that. It was super exciting. A new colleague at the Better Than Cash Alliance, Camilo Tellers, was part of that. And if you're interested on this ecosystem convening approach, then please put that into your questions, and we'd love to talk to you more about that. So after that brief, interlude, Brian, back to you.
Thanks, Ruth. Before we go any further, I just want to give everyone a little bit of an overview of what's in the toolkit, and we'll talk about more of that in detail today. So in the toolkit, you'll have access to some descriptions of payment concepts and terminology. That's great for those of you who might be new to analyzing payment systems, but even if you are more of a payment expert, this is really important information to have to convey to your clients and stakeholders and partners, so everyone's on the same page with what different terms and concepts mean. In the toolkit, you'll also be able to read about the specific methodology we developed for analyzing the payment system and how you can tweak it or modify it to fit the needs for your specific diagnostic. And finally, in the toolkit, you'll get some practical tools to actually implement a diagnostic for yourself. We think this is a really important part of the BTCA diagnostic toolkit, is how practical we've tried to make it.
Yes, and that's the same for all these toolkits, is that there are lots of different calculators and things like that in it so that people can adapt it for their own purposes. So we have polls throughout this webinar so that we can hear from you and you can see who else is on the call. So this poll that's just come up is asking, what type of organization do you work for? So all of you who are participating in this webinar today, please click on the bullet point next to the type of organization that you're working for. If you're from a government agency, wonderful. A donor agency who would be funding this, also completely wonderful. A development community who cares deeply about the ecosystem, terrific. And we love consultants because you're going to be doing a lot of this work. So we really hope there's a lot of you on the call today. So 5 more seconds and we'll close the poll. And I think the results will come up right now. Oh, how wonderful. We have lots of consultants. We love you. We know that you're going to be doing a lot of the work on this, so glad that you've joined us. For those of you who are in the other category, maybe academics or other, please do add into the question section so we can read where you're coming from, so that we can better understand, because as we noted at the beginning, there's going to be a month where we can get feedback from you about how to improve that. And so maybe there's a stakeholder group that we haven't quite thought of since so many are in the other category. So, Brian, great news, right? So we know that there's going to be a lot of consultants who will be conducting this diagnostic. So this is what we hoped for, isn't it?
Great news indeed, yep. We did write this toolkit primarily for consultants. We do think they'll be the main users for one of 2 types of primary clients, either conducting a diagnostic on behalf of governments or conducting a diagnostic on behalf of a donor or other kind of development partner. In either case, it's important not only that the consultants themselves understand this methodology, but also that their clients, the governments and donors, do too, so they can help facilitate the study and be in a position to understand and implement any recommendations. So it's great to see some governments and donors on the line as well. So I just want to spend a second talking about how a government or a donor could use a diagnostic that's conducted by a consultant. So first, how would a government use a diagnostic? One, they could use it to create a roadmap for designing new policies. A diagnostic could be a great tool to prioritize the policy levers that you have in a given country context and design new policies. Second, it could be used to establish a baseline for evaluating the effect of policies. We think this methodology could be repeated over time, and you could see how the trajectory is shifting based on what you're doing with policy. And third, a diagnostic could help policymakers identify and reach out to potential partners to understand what's working, how to change incentives, and build momentum. Oftentimes, policymakers have a pretty narrow view or limited view of the market, and they see who they regulate or oversee, and a diagnostic is intended to broaden that horizon. So how could a donor use a diagnostic? Well, pretty similarly. We think donors could design their country strategies and prioritize their resources in a country based on a diagnostic. And they could also use a diagnostic to establish a common understanding and division of responsibilities with other donors and development partners working on payments in the same country. It's often a crowded marketplace, and you don't want people working at cross purposes or based on a different understanding of what's going on in the payment system. So we think a diagnostic could really help convene and unite development partners in the same country environment.
Yes, and exactly, and that's what we've discovered is that all the different ecosystem players are extremely interested in being part of this, looking at it as a whole ecosystem and actually talking to each other, because that doesn't always happen. So that is a benefit that has come across very much more strongly than we anticipated at the beginning. So for those consultants who are going to be taking on this diagnostic exercise, what makes a Better Than Cash Alliance diagnostic unique?
Sure, Ruth. So on this slide, you're going to see one of what we think of as the 3 biggest distinguishing characteristics of a BTCA style diagnostic, and that's the use case. We recommend using use cases to help you focus your diagnostic rather than looking at the payment system as a whole. So this slide here shows a pretty technical definition of a use case from the world of payment systems. We think this definition should be a starting place for choosing how you focus your analysis, but not necessarily an end point. And in fact, in the case of the 4 BTCA diagnostics, we chose a little broader definition actually than these, which I'll get into later. The second 2 defining characteristics, which I'll just mention here, but we'll get into in more detail later, are number 2 is the importance of the participation and the buy-in and the commitment of your main stakeholder or client or champion in the country. And the third characteristic would be that we provide a set of indicators that you could repeat over time and modify as well. And as you can probably tell, and as I'll be emphasizing throughout, the methodology is really customizable and scalable and adaptable for your needs and your resource constraints.
Terrific. So, and I want to make sure people remember that because we're going to come back to use cases later on, right? So I'd like to take the opportunity to do our next poll now, Brian, because there are lots. You mentioned other diagnostic methodologies, and it would be really useful to have a sense of where what all the people on the call are aware of. So, and here you don't just click one, you can click several. There's a function for clicking all of them. And for those of you who are payments experts, I'm sure you'll click all of these, and maybe there are others that you want to add as well. So which other payments diagnostic methodologies have you seen? The FSAP, is now CPMI, but was CPSS, Red Book, the World Bank Retail Payment Stock Taking. So if you've seen one or all of those, do click on it. And obviously the total is going to be well over 100 for this one to see where people come from. We'll give you just 5 more seconds to click on whichever ones that you've seen, and then we will close the poll. So, how interesting. We've got about it's probably about a 50-50 split, that there are some people who've seen none of these, and others, if you're in this world, then most of you will have seen the FSAP or know of them. They're not always public. In fact, rarely public, and so you know of them. And then our friends at the CPSS, now CPMI, Red Book, and the Retail Payment Stock Taking. So, Brian, that's great to see the mix of experience on the call on the webinar today.
Yep, exactly, and these are great resources for those on the call to be aware of, and if you aren't aware, you should go dig into these if you're going to conduct a diagnostic for yourself. Let me take a quick minute to go over each one of these so I can explain why we wanted to supplement them and what you could use them for as you start your diagnostic. So the FSAP is a World Bank and IMF study that looks at one country in particular and evaluates its financial sector against various international standards. We think it's great that this kind of study has deep stakeholder involvement, but as you just mentioned, Ruth, the key thing is that these reports aren't public. So that means the public can't read the evidence and build on the knowledge and the methodology, and it makes it tough to evaluate and track any recommendations and policy prescriptions that the FSAPs suggest. So that's not necessarily a bad trade-off, but it's worth thinking hard about when you do your own diagnostic. So in the BTCA toolkit, we discuss the pros and cons of making your own analysis and recommendations public. So the next one, the red books, and there are other color books as well, depending on your geography, they also look at one country at a time, and they look across the entire payment system and actually assess many of the issues that we'll be talking about today in terms of incentives to shift to digital. But because they're so broad, it's difficult to prioritize where to start. And probably more importantly, they're not conducted very frequently in each country. So if you're using them to design policy or a country strategy for a donor, unless they've been conducted really recently, they might be out of date, especially in a fast-changing world of digital payments, which we all know. So if there is one in the country that you're interested in, you should absolutely go and read it for background. And if it's recent, that's great. But it's more likely to be background reading.
Brian, just one thing there. For people that have come in asking, are we on the right screen? Yes, yes, we are on the right screen. you're just going through these different ones because several of the people asked for a bit more information on it. So do keep going.
That's right. Just one more to go, everyone. The last one I want to talk about is the World Bank retail payment stock taking. It's actually the most similar to the BTCA diagnostic approach. We think it's a great resource for understanding how a diagnostic can be used and what principles should guide your analysis. You can actually find a link to this methodology in our toolkit. We felt that to really implement your own diagnostic, though, you would need some more practical advice, as I mentioned earlier on. So in the BTCA toolkit, we try to explain the how of a diagnostic in more depth than they were able to get into in the retail payment stock taking report.
Yes, we're really trying to be very practical here because this is an area that's increasing importance in the development agenda, not just the financial inclusion agenda. So we're really trying to provide a resource in response to demand, building on the great work that our friends and colleagues in the payments specialist area have been doing. So where do we start? What's the first question to start with, Brian?
Thanks, Ruth. As you can probably tell, the first thing you got to decide is how you're going to focus your diagnostic. So on this slide, you're going to see some of the factors you can use to prioritize the use cases that you're going to use. And those factors will probably fall into two main categories. You're going to want to balance your interests against your constraints. What kind of interests might you have? For one, you might want to choose use cases that tackle the major themes of the payment system or that let you tell what you see as the main stories for policymakers or donors to be aware of. Another interest you might have is a particular donor interest. The donor you're working on behalf of might care a lot about mobile money, so they might want you to spend a lot of attention looking at the incentives around mobile money in the country. The constraints you're going to have are going to be two. One, the technical expertise that you're going to need. The narrower and more technical use case you choose and the more specific, the more technical expertise you are going to need on your team. And also, you're going to need a higher level of in-country knowledge and resource and staffing. As we'll get into later, a lot of these sources that you're going to need to rely on don't necessarily have their data public or it's hard to get appointments with these sources. So the more local knowledge and expertise and entree you have, the better. And so these are the kinds of things you're going to have to weigh when you choose how detailed and specific to make your use cases.
And just as a reminder, as I had pointed out earlier, in terms of the use case, a definition of use case for those who are not familiar with that term, it's either a specific store of value, such as a bank account or a mobile wallet. It's a specific channel or a specific payment instrument. And I will also say again that this, at the end of it, you'll have a link to the toolkit so you can go back and check all these definitions and things like that. So, Brian, let's just be really specific. What were the use cases you used in the Philippines, for example, a diagnostic that you undertook?
Sure. Actually, in all 4 diagnostics, we used the same 3 use cases. So you can go to the Columbia Diagnostic Report and check out the analysis for the same 3 use cases that we used in the Philippines. The first use case we chose was bulk credit transfers. So these could be salaries, pensions, social welfare payments, payments to suppliers, any type of one-to-many payments. The second use case that we used across the countries was remote bill payments. These would be many payers to one payee. So this is things like utilities and tax payments. And the third use case that we chose was debit card payments at merchants. In none of these 4 countries is over-the-counter mobile or credit card payments very advanced. So to capture a consumer merchant payment stream, we chose to look at the incentives around debit cards. Now the key for us in choosing these 3 use cases was that they could all be evaluated across all 4 of our countries. We were really trying to build up the methodology for BTCA, and that's obviously not a priority for you. So when you choose your own use cases, you're going to have to weigh, like I said, your own interests versus your constraints, and you might make different decisions than we did.
Brian, one of the questions that had come in was that people couldn't see the URL for the Columbia link, and we've now shared that in the question box with everybody. So that link is, some people couldn't see it on the screen, but it's now available for everybody. So thank you for mentioning that. So prioritizing use cases to start with, what's the next step?
Right. The second thing to tackle is the level of commitment and participation from your main client, champion, or stakeholder. And as you can see on this slide, which comes again from the Columbia diagnostic, you'll need some data to help you understand the incentives across the ecosystem. And this data can be hard to get. Some of it might even be sensitive or confidential. In Columbia, as you can see, we collected the costs and pricing of various payment mechanisms. As we'll talk about more in detail later, those costs can play a big role in understanding the incentives of the actors in the payments ecosystem. And because this isn't typically public information, your champion or main client will need to get you in the door. Now, your client, champion, or key stakeholder may take on a variety of roles besides just providing you their own data. One is, as I just suggested, was you might need them to introduce you or endorse you to other players in the marketplace. This is going to be very important if you, for example, don't already have a relationship with the tax authority or the pension office within the government or in the business world with the local chamber of commerce. So you're going to need the endorsement from your client or stakeholder to be able to understand these incentives. And the role that that your main client takes is really going to help you set the boundary for what you can accomplish in the research, and not only that, how seriously you can expect them to take your recommendations afterwards. So you're going to want to negotiate and agree upon that role up front.
Yes, we've been very lucky to have great champions in doing those diagnostics, so it really does make a difference. I just want to take a quick look at what we've got on the screen here. So under the non-bulk payers column, if we look under time to credit value received, you've put here same day or next day. It's done at banks, but it's 3 to 7 days in non-banks. So this is the kind of data that it's not what just one person tells you is actually going to happen. What is the reality of them receiving the value that has been transferred. So, you know, that it's really important to get that accurate information there. So
that's right, and you might not be able to get all this information from just one source. Sometimes a corporation, for example, won't be willing to tell you what prices they pay to their financial provider. On the flip side, the financial provider might not be too willing to share the fees they charge to their clients. So you're going to have to really triangulate this data from a wide variety of sources so you can build a solid understanding of the incentives driving all the actors in the ecosystem.
Yes, and we're going to be talking a lot about incentives, aren't we? So what's the third step?
So the third task is going to be agreeing on your set of key indicators. So on this slide, you see a lot of indicators. Don't worry about reading them all. What's important to understand is that there are indicators relating to all of the actors in the payments ecosystem. You can see some for government, some for financial providers, some for regular businesses, and so on. You're going to want to understand the incentives for each, however you define the individual indicators. Often you'll see that some actors have strong incentives to shift, whereas others don't. So if you don't appreciate the incentives across the ecosystem, you're going to get a possibly too optimistic or pessimistic view of the trajectory of digital payments.
So from the forecast, wait a minute, there's just a question come in, Brian. Somebody's asking what is GBD&P? So that's government business development partners, right? Good
point, Ruth. Good to bring that up. And for those of you wondering that, tune in tomorrow morning, same time, same place for the measurement toolkit webinar, where my colleague Wajiha Ahmed will tell you all about payments measurement and assessing and understanding the types and volumes and values of payments made by all those stakeholders.
But specifically, it was on the previous screen where it says bulk payers, GBD, which was government, business, and development. So that was just for those of you who are asking that question, that was on the previous screen. Sorry about that. So whenever we use those letters, that's what it stands for. So thank you for your question. So Brian, do we have, you've talked about this generally, but can you give us an example from where having indicators for all of the stakeholder groups was helpful?
Absolutely. So we actually, midway through our analysis during the Nigeria diagnostic, took these indicators to our primary champion, the Central Bank of Nigeria, and reviewed our analysis up to that time with them. As you'd probably expect, they gave a lot of emphasis to what is possible under the laws and regulations, but less emphasis on the how those rules were being interpreted in the marketplace, how they were shaping the incentives of payers and payees as well as the financial institutions. So we thought bringing those other incentives really rounded out our understanding. And had we just gone to our primary champion and asked what was going on, we would have gotten a much different picture of their trajectory in Nigeria. So you want to take a look at these indicators and consider if they're the right ones for you. And if you come up with new ideas, please share them. At the end of this webinar, Ruth will tell you about our online forum on Yammer so that you can share your feedback and how you're molding and expanding and changing these indicators to fit with your needs in your country.
Yes, so that these indicators are so that we're able to evaluate these indicators to see how they can paint a picture of the trajectory. We do need to understand the incentives. So how do we understand that? How do we evaluate these indicators, Brian? What have you got?
Sure. So one, you're going to have to talk to a lot of sources, and in the toolkit we give a sample list of all the kinds of sources we consulted. And then to really get you started, as you can see on this screen, we've also provided a structured interview guide that you can go through with the institutions that make and receive payments, like government agencies, businesses, development partners, as well as their partners in the financial industry. So I'm going to briefly go through a few of the screens from that structured interview guide now. Starting with the quantitative data you'll need, like costs, which we've talked a little bit about, then looking at other factors that might influence a payer or payee's incentives to choose one payment mechanism over another from what's available today. And lastly, I'll show you some questions from the guide that you can ask to flesh out some practical barriers to change in the future. So this slide shows how you could organize the existing payment options available to a given payer or payee and which options they're using today. This next slide shows you the types of costs those payment options come with. And of course, as we've talked about several times already, those costs can really drive incentives. One thing to note on this slide, as I already mentioned, is sometimes you might get this information directly from the payer or payee, or it might come from their financial institution. You're going to have to ask around because this kind of information can be really sensitive.
So this is the cost issue, but it's not, I mean, for those of us who come from business, of course, cost is a major issue, but it's not always cost, is it?
That's exactly right. So when we look at the next slide from the structured interview guide, we'll see some other non-cost attributes that you can use to get a certain payer or payee to compare their available payment options today. You want them to explain their choices to you so you can get a sense of what institutions like theirs value when assessing their options.
So why don't you give us an example, Brian, from Colombia or the Philippines of when one of these factors was more important than cost?
Absolutely. One thing that we saw in our diagnostics, and even more prominently in the case studies that we did for BTCA, particularly on corporate payments in Nigeria and Philippines, which will be released soon, is how important the issue of control is. If you're a payer, for example, if your company is making payments to suppliers, you want to keep the value of that payment in your bank as long as possible. And if you're concerned about cash flow, maybe you want to stagger your payments during the month. Traditionally, checks, especially if you issue them yourself, have been a great way to assert that control. But for suppliers, if you're on the other end receiving those payments, that control all of a sudden doesn't sound so good.
Yes. We all know that the checks in the mail, people manage their cash flow because it somehow is delayed in the post somewhere. Yes, we understand that completely. So if we understand those kind of incentives, how can we get at their likelihood to change?
So on this next slide, the last slide we'll talk about from the structured interview guide, we get really at the heart of why payments aren't shifting within a certain use case, to look at the barriers to change. Some of these factors relate to external issues, such as regulation or how willing your financial provider is to come up with products that are right for you and have the right costing. And some of the barriers are likely to be internal. Some parts of your staff, accounting department or on the operations side might be used to doing things a certain way, might have vested interest in doing things a certain way, and so might be resistant to change. So those are the things that you're going to try to tease out in these interviews to understand why a certain payer or payee is unlikely or more likely to change their payment behavior going forward.
Okay, there's some really interesting questions, points for discussion here, Brian. So I think I'd like to ask those all on the participants on this webinar to see what, in their experience, are the most common barriers. So you can see these 4 points here are taken from the previous slide. So for you, in your context or more generally, what are the most common barriers that you've experienced? Is it the current government regulation or tax policy discourages digitizing payments? Is it internal to your own organization, the accounting systems and procedures? Is it an ecosystem issue, that there's an acceptance problem? Or is it just a data thing that nobody understands how to evaluate the business case to change? So what do you think in your experience is the most common? I guess you can pick more than one if you want to, but we're asking you the most common one to see in your experience what is the barrier. So we'll give you 5 more seconds to click, and then we'll see what everybody thinks here. Okay, let's see what the results are. Wow, it's like a 3-way split between government regulation, acceptance network, and lack of knowledge about how to evaluate the business case. Fascinating here. So this means that given your experience, there's issues to do with government regulation, what's happening in the ecosystem, and within the individual business. So that's a really interesting mix of responses we've got here. So Brian, what does that tell us about the kind of expertise that's needed to undertake this diagnostic if these are the kind of barriers out there?
Right, so as you can probably tell, the kind of team you build is going to be a balance between the use cases you choose and the resources that you have. So what we've done here on this slide is give you a head start to building the team that you need to undertake a diagnostic. You can see here some sample language that you could use in a terms of reference, either internally to match your own staff with the appropriate role to conduct a diagnostic, or to go out and hire specific technical experts or local resources.
Okay, so there are great practical tools for people to take to be used in this toolkit. And so what I'm just looking at a question, that several of the questions coming in, and I just want to say that we will be coming to questions in a minute or two. So if there are other questions, please, this is the time to get them in so we can read them and have time to respond. So and remember that you do that on the right side of your screen under the question box there. Thank you for all of you who've been contributing. And so, Brian, one of the questions that came in was, there's a plan to make the diagnostic, is there a plan to make the other diagnostics, not just the Colombia one, available? Philippines and Malawi are members, and they are in process. We're working with what's public and what's not, but that they will be made public before too long. And the Nigeria one is still in process. As you know, there's lots going on in Nigeria at the moment, and so that's still in process as well. It'll be a bit longer before that becomes public.
Right. When we initially kicked off these diagnostics, we didn't expect that they would be public. They were internal documents for our champions, but more importantly than that, they were designed to help us build a methodology for BTCA and for you on the line today. So we think it's great that some of the champions have seen such a strong case for using the diagnostics, not just internally, but publicly, to explain their policies and to build partnerships in their own country context using the diagnostics. So we think it's great that they're starting to come out publicly, and happy to see that.
Okay. Brian, let's take some of these questions that are coming in the last 15 minutes then. This looks like a lot of work. If someone's planning to do a diagnostic, or if a consultant is just starting out for one of their clients, how much effort is it going to take? You know, can you give us a sense of that?
Sure, Ruth. So it's, as you can imagine, it's going to vary by how detailed your use cases are, and not only that, what existing data is out there. So if you're working on behalf of a donor in a country that has a recent red book or other color book, if you were featured in a World Bank retail payment stock taking, if you can get your hands on a recent FSAP from the country, you're going to have a great head start, and maybe you can do everything with desk research, making a few phone calls to local experts. But if you don't have that wealth of recent credible information to go on, you're going to have to do more digging. And so in the BTCA case, we used in each country a team of 4, someone with payments expertise, someone with measurement expertise, someone with more policy expertise, and oftentimes someone who had a real wealth of local contacts and connections. And it took, you know, a few weeks up to a month of research on getting existing data prior to visiting the country, and then, you know, a week or 10 days of interviews with stakeholders across the ecosystem to really understand the incentives across the board. So it's going to really vary. It's the only thing I can say, Ruth. Okay,
so yeah. But some of the question was a very specific one about how much time it's going to take. So, and obviously, you know, Malawi was different from Nigeria in terms of massive size different in country. So what I'm hearing you saying in terms of timing is that there's the research time up front, which depends on how much is available beforehand. But then if you've got to go and do a lot of it in person, then you're going to need a bigger team or a longer time on the ground. So
right. One other factor that's going to shape your time commitment is the extent of measurement work that you're going to want to do or need to do to understand the incentives of your chosen use cases. And that's something you're going to hear a lot about, as I said, on tomorrow's webinar on measurement. If you have to chase down, for example, the local water board or a tax authority at a local level, or small businesses or consumer groups to understand your specific use case, that's going to only increase the amount of effort required. But if you're looking at use cases that are much more general, much more understandable by, for example, just talking to financial providers or regulators and some big businesses, then things are going to be a lot easier for you.
I think one of the important things to point out here, Brian, with respect to the collecting the data, is that we're concerned about all of the payments, not just the formal sector payments, because many low-income clients are working in cash, and so understanding the cash, because we want to understand where that is and how, so that it can be transitioned to some form of electronic or digital payment or transfer option. And so that will take time because it's just not so well documented, and that's you know, because we're looking at an inclusive approach, because we're working in development here, and we want to understand the whole how the whole ecosystem works. So that will take, I mean, depending on the context, of course, will take more time because it's just less well documented.
Absolutely.
So another question that's coming in is talking about taking this diagnostic on a regional basis as opposed to a national basis. If you have very big economies, a region or a state, it makes sense to understand the ecosystem there as well, or I think their question is, does it make sense? It would seem that it would make sense to be able to do it at a large regional level as well. What are your thoughts on that, Brian?
Good question. So one of the things that we did to pull the analysis together in the BTCA examples was use scoring to summarize and encapsulate the incentives in our indicators. So that would really help you compare across countries within a region, and that's exactly why we chose it. We were using the same use cases in all our countries, and to actually build up the methodology, we wanted to be able to compare one country to another. So maybe that's an approach that we could support if you're looking at the same use case in multiple countries across a region, is really using more numerical scoring to compare the countries and the incentives and the trajectories within a region. So totally possible. If the more countries you add, and if you're not deepening your technical expertise and your resources, then you're going to be broadening your use cases likely. But great idea, and it would be great to see this approach expanded like that.
Yes, the question was around within a country, and so the regional question was about regions within a country, not across countries. Sorry.
Oh, sorry, I misunderstood that.
No worries, but the same principle applies, is that if you're looking at an ecosystem within a state within a large country, then you can look at a state, and then if you could put all the states together, then you would get a great country analysis. But there are many states in large economies that are the size of national economies. So yes, it would work at a state level or a sub-national level as well, right?
Right, and you could choose a use case that would really help you in that. For example, if you chose to focus on mobile money and agricultural value chains, that's a very narrow use case, and it would change your geographic focus as well. So absolutely, you can choose the geographic as well as the subject matter focus of the diagnostic. The key thing is getting the incentives of everybody in that ecosystem.
Okay, so we know that we have a lot of consultants participating today in the webinar. So if they're talking to governments about what's going on in the ecosystem, what do you think would be helpful to identify for governments that they could benefit from in doing a diagnostic? If they had not thought about it before and you were talking to a government partner, how could you explain to them that they would benefit from this?
Good question, and something that we've come across since developing this methodology. Some of the governments you deal with have already shifted their own payments. For example, we're talking to a Ministry of Finance now that says, we're done. We make all of our payments to civil servants, to government suppliers, and our social welfare payments electronically. Aren't we done? But they get a directive from the national government putting them in charge of digital payments strategy in the country. So they're looking around and saying, what else can we do if we're already doing all of our own payments electronically. But those government agencies have other policy levers and connections with other government departments. So a country diagnostic can really help those governments look across the ecosystem to see where else they can push besides just their own payments, where the opportunities are, where the barriers are. So that's a big use for governments that might be further along than, for example, the Malawis that we looked at in these BTCA diagnostics.
So that's a great point, because they don't have a view of all the business and consumer payments, or understand how their own actions might be a challenge for businesses or other retail-focused companies working on there. And so that's where an ecosystem view really does help, because then they can see how their role in facilitating the development of an inclusive payments ecosystem, an inclusive financial ecosystem more broadly. And so there's great opportunities here. So
one of the biggest challenges often for national government agencies is seeing what's happening at the local level. So it can be a huge motivating factor to increase their influence and push down to a more local level the impact of their policy. So this holds not just for ministries of finance, but tax authorities that kind of divide their responsibilities and what taxes they collect between the national and the local levels. So it's a big factor to consider.
Yeah, the tax issue, when we did the government toolkit on Tuesday this week, we actually used the tax collection as a case study in that toolkit, because it's really important for governments in terms of not just domestic resource mobilization, but also in terms of transparency. And for individuals paying taxes, it's much more transparent for them to be able to pay electronically than have to hand it over to a tax collector. So that was a really important factor in the government toolkit. But let's just take the other side for a moment, Brian. So is it worth doing this diagnostic without active participation from the government? I mean, or is that essential?
Good question. It's if you're doing a diagnostic academically and you just want to understand the use cases, the incentives around the use cases in a country, just to build like an academic understanding of the payment system, absolutely. If you're doing it for donor or development partner country strategy, probably. The important thing about stakeholder and government specifically involvement is that if they're not involved in conducting the study, in facilitating conducting the study, and in the analysis with you, it's going to be tough to get them to buy into the recommendations that you make at the end of the day. So if you're doing a diagnostic on behalf of government or paid for by a donor for government policy recommendations, you really want the government to be involved in any range of those roles that I discussed earlier in the webinar. Otherwise, it's going to be really hard to translate what you find into policy change.
And what was interesting in our experience is that it then generated a real interest I mean, the government was involved for its own sake, but then was very, very interested in the whole ecosystem engagement as well, and how they could, how supporting a digital ecosystem was actually benefit them. So the initial engagement was unsure, and then it generated a whole lot of other benefits they hadn't considered before. So it's worthwhile getting started even on an experimental basis, because then that highlights issues that are very relevant nationally to governments, or regionally to regional governments on, state level, I should say, so we're not misunderstood there, at a state level to help them. So the benefits outweigh the costs in that regard. So there should be a good argument to help governments being involved. And of course, for us, the member governments are already committed to to a digital future, and so it's an opportunity for them then to realize what the steps are to take to proceed to achieve their goals. So we're just about at the end. I think we have a very, very quick last question coming in, relates to, do you need to do this as well as the measurement toolkit tomorrow? You talked about what was happening tomorrow. Can you just give us a quick link?
Sure. One thing that you can use measurement, so my colleague Wajiha will speak about understanding payments measurement across the ecosystem tomorrow and all the methodological challenges that entails. And one thing that can really help you do is understand the quantitative importance of the use case you've chosen. Like I said, mobile money and credit cards haven't developed as much in the 4 BTCA diagnostic countries that we did, and one way we knew that is because we measured and made assumptions about and estimated all the payments in the country by all the stakeholders in the economy. And so doing that measurement is really going to put your analysis in context. The measurement can also be great for setting a baseline to assess any policy changes, so you can see how payments shift to digital between which payers in the economy. But the extent of the research you do, again, is going to depend on how much time you have, what expertise you have, and what existing data is out there, and Wajiha will speak to that in much more detail.
Great. Thank you for that quick response. So next steps. Following this webinar, you'll receive a link to join a toolkit community on Yammer. I don't know why it's called Yammer, but that's just the name of it. And you'll be able to download the toolkit and then interact with authors and others who are participating in this. And so we want to make sure that this toolkit integrates your questions and suggestions for improvements, things that are missing that we need to add in, extra examples that you want to share. So that'll happen over the next month, and then we will have our new website going live in April, and the toolkit will be web-enabled on the website, and so that will be a resource for members and for anyone who wants to use it in a way that will promote the digitization of payments. So we are really looking forward to that. But before we get there, please engage with us on this Yammer site. And so let me take this opportunity to thank you to everyone who's participated. If you want to stay engaged with the Better Than Cash Alliance, you can follow us in the usual places and sign up for our newsletter on betterthancash.org. And of course, a huge thank you to Brian and all the other members who were involved in the development of this toolkit. And of course, our colleagues who work in payments more generally, whose great work this complements. So thank you very much, and look forward to talking to you tomorrow at the same time. Bye for now.